I'm Susie Sa in tonight for Pat Harvey. LA County health officials are once again sounding the alarm about the rising number of COVID cases. Tonight, LA County is reporting nearly 4,300 new COVID cases and 15 new deaths. Hospitalizations have climbed steadily in recent weeks. County hospitals are reporting 530 COVID-19 patients tonight. KCAL9's Joy Benedict is live in Studio City tonight to tell us more about that. Joy?
Yeah, Susie, I mean, it certainly is, and they are alarming numbers, but we feel like we keep hearing these numbers and nothing really is changing. Well, things are changing because the virus is changing, and that's why it's very important that many places like this pharmacy here behind us continue to see many people coming in looking for COVID vaccinations and boosters.
I got the Rona.
It's a message many of us are hearing from friends and loved ones, as CBS's Gayle King announced right after the show that she tested positive.
I'm leaving. Finally happened to me. I'm double vaxxed and boosted. Go figure.
And more vaccinated individuals are getting the same result.
It wasn't super bad the first time, but of course, I don't want COVID again.
Which is why 3 months after being infected, Sarah Hansen came to Elements Pharmacy in Studio City to get her first booster.
I always think it's safer to be vaccinated, Better safe than sorry.
And she isn't alone.
Most appointments are for boosters, mostly second boosters, and also a lot of testing appointments because we have a surge going on right now.
Sherry Sherman is the pharmacist here. She says with the new uptick in cases, patients want as much protection as possible.
Just because it's mild one time doesn't mean it'll be mild other times.
This isn't just the same old story or old COVID.
Unfortunately, with Omicron, it's very, very infectious. It's more infectious than the original COVID.
Infectious disease expert Dr. Kimberly Schreiner says whether it's natural immunity or a vaccine, there appears to be an expiration date.
About 3 to 6 months after you've had natural infection on top of the vaccines, your antibody levels will begin to drop, and that's when you're vulnerable.
Which is why boosters are so important. But as the virus is changing, the vaccine is now too.
Both Moderna and Pfizer are working on an Omicron-specific recipe, if you will. That's the beauty of the mRNA technologies. You can kind of just dial in a different recipe. And they are working on that right now, and the anticipation is that's the vaccine that will be deployed in the fall.
But predicting which variant will be most prevalent in a few months isn't easy. So health experts say the best thing we all can do is stay up to date on shots and be smart, because no one wants to play host to COVID.
And let's just hope that my symptoms stay mild, because right now it really does just feel like a cold.
And we're certainly hoping it stays that way for Gayle King. Now, there is going to be a fourth COVID vaccine possibly on the market here in the United States. The FDA will look into Novavax next week. That is the vaccine that'll be the first one that's not a messenger RNA vaccine. It was made the old-fashioned way. However, health experts don't recommend you wait for it. They say if you're due for a booster, go ahead and get one. Susie?
All right, Joy, thank you so much.